Are you struggling with lower back pain and leg pain from an L4-L5 disc herniation or an L5-S1 disc herniation? Are you looking for therapies that'll help alleviate your pain permanently, improve your mobility, and restore overall quality of life without drugs or surgery? Then this video is for you. In this video, I will show you how non-surgical spinal decompression has been used to successfully treat patients with L4-L5 or L5-S1 disc herniations. Not only does non-surgical spinal decompression offer quick relief of leg pain and back pain, but it specifically works on restoring the health and integrity of the herniated disc. That's what's most lacking in conservative treatments today. It's also what makes spinal decompression unique. Spinal decompression is specifically designed to provide direct treatment to the injured lumbar disc, and it's a safe alternative to risky and invasive spinal surgery. And that's exactly what our patients tell us. They want to avoid back surgery, and most likely so do you. So in addition, be sure to watch to the end of the video, because not only will you learn about how spinal decompression therapy works, but I'll also give you some spinal decompression exercises you can do at home to start relieving back and leg pain. Hi, I'm Dr. Steve Silverston. I'm a chiropractor in Ellicott City, Maryland, here at World Class Chiropractic. I bring you over 30 years of clinical experience helping people recover from conditions like low back pain, sciatica, neck pain, upper back, shoulder, arm pain, headaches, and more. This channel is about giving you tips and strategies to live a pain-free, healthy, and fulfilling life. Before we dive in, be sure to subscribe to my channel if you're looking for ways to enjoy a life free from pain, filled with health and joy. I upload a new video every week. We've treated hundreds of patients with L4, L5, L5-S1 disc bulges or herniations using non-surgical spinal decompression, like Bob, who first came to us with lower back and leg pain and weakness and numbness in his feet. He had difficulty walking, sleeping, golfing, and constantly felt irritated, which was impacting his work and his relationship. You'll learn more about Bob's case later. But first, let's get started by explaining what non-surgical spinal decompression is, how it works, and what to expect when you have spinal decompression therapy. Non-surgical spinal decompression is a therapy aimed at relieving back pain and discomfort, particularly associated with conditions such as herniated discs, degenerative disc disease, facet joint syndrome, and sciatica. It involves gently stretching the spine to alleviate pressure on the spinal discs and promote healing. During a session of non-surgical spinal decompression, the patient typically lies on a specialized table or chair where the upper and lower halves of the body are secured, and the table then moves in a controlled manner to gently stretch the spine, creating space between the spinal bones, which creates negative pressure within the disc. This negative pressure can help retract herniated or bulged discs, reducing pressure on the nerves, and promote influx of oxygen, water, and other nutrients into the disc while helping pump inflammatory waste products and toxins out of the disc. And all this helps to facilitate healing. In our office, we use a machine called the Ergo-Flex Back-On-Trac, and we couple this therapy with corrective chiropractic care and cold laser therapy to get the most amazing results for our patients. This helps to really get to the root cause of the problem and address it, resulting in great long-term results. Patients not only feel better in the short run, they actually get better and stay better. Home care exercises and instructions are always helpful so that you can continue to work on and maintain your spinal correction for life. I'm going to show you some basic, easy exercises you can get started with. But before I do, let me first tell you about Bob. Bob first presented to our office with low back pain that would radiate into his butt, down his leg, causing pain, weakness in his legs, and numbness in his feet. He had difficulty walking, sleeping, golfing, and constantly felt irritated, which was impacting his work and his relationship with his wife. Years prior to coming to our office, Bob had been diagnosed with a herniated disc and had physical therapy, medication, but he continued to have episodes of sciatica on and off over the years, and now he was having the worst episode ever. Upon coming to our office, Bob was thoroughly evaluated, and we got started with a care plan consisting of corrective chiropractic care, cold laser therapy, and non-surgical spinal decompression therapy. Bob immediately started feeling better, and as of his first progress evaluation, his low back and leg pain was greatly diminished. The sensation in his feet was so much better, and he was almost 100% less irritable. Because of the care he's now receiving, he can not only expect to feel better now, but Bob can expect a long-term solution to the underlying problem so that he doesn't have to continue to suffer in the future. Bob always mentions how he loves the decompression therapy and how awesome the Ergo-Flex Back-On-Trac is. This is why spinal decompression is an important part of our treatment program, and why, if you have a lumbar disc bulge or herniation, you should consider spinal decompression for yourself. Now, I want to give you some basic spinal decompression exercises you could do safely at home so that you can start to get some relief from low back and leg pain. Always remember, don't do any exercises that increase your pain. And it's always best to get cleared by your doctor first. And when you're ready to get more advanced treatment focused on correcting the problem and providing a long-term solution, look for a qualified corrective care chiropractor in your town. These exercises I'm about to share with you are very simple entry-level exercises that may help you begin to ease the pain and discomfort associated with a lumbar disc bulge or herniation by gently creating space between the spinal bones and decompressing the disc and those nerves. Go slow and easy with this, and only do what feels good and you can easily tolerate. Never force anything. Let's start with the pelvic tilt. Lie on your back on a firm surface with your knees bent, pressing your feet onto the floor. Gently press the small of your back into the ground while lifting the tailbone ever so slightly. If you do this properly, this will tilt the pelvis and take pressure off the spine and open the disc spaces. Focus on relaxing and elongating your spine. It should feel good. See if you can hold this posture for 5 breaths or 30 seconds at a time, and work your way up to doing 10 repetitions. Next, you can graduate to a hanging pelvic tilt. You can do the same motion with your pelvis, helping to take pressure off the spine and discs while hanging from a chinning bar. Or if you don't have one, you could just use the top of a door. Just make sure that the door is sturdy and can easily support your weight. This may require some upper body strength, so start gently, beginning only partially hanging, using your legs for support. Next is the cat-cow stretch. Begin on your hands and knees. Distribute your weight evenly between all 4 points. Exhale and arch your spine, drawing your chin into your chest. Inhale and gaze upward, relaxing your belly toward the floor. Be gentle and easy and don't force anything. And as you do this, you'll get motion in the spine, warming up and opening the disc spaces. If it's comfortable and easy, continue this fluid movement for 10 repetitions. Start with 1 set of 10 reps, go slow and easy, and work your way up to 3 sets of 10 reps. Next is child's pose. While still on your hands and knees, slowly lower your hips and back toward your heels. Extend your arms forward or place them at your sides. Gently rest your forehead on the floor if you can. Breathe deeply, focusing on releasing the tension in your body. Hold this pose for up to 5 minutes. These basic simple exercises will get you started on decompressing those discs and can help start to provide some relief if you're in pain. Over the years, a lot of patients have asked me about the teeter inversion table. I like to tell people if you're going to do that, you need to be fit, and even if you are fit, you need to be very careful. We weren't designed to be hanging upside down. We have very big, strong blood vessels in our legs and lower body, designed to handle the pressure of our weight and gravity. But in our heads, we have tiny little blood vessels that were not made to take that kind of pressure, and it could pose potential risks, like increased blood pressure, which can actually lead to stroke or heart attack, falls, which can cause severe injuries to the spine and head, even if falling only a short distance, which can end up being disabling or even fatal, pressure behind the eyes that can contribute to glaucoma and cause damage to the optic nerve, not to mention increased intracranial pressure, which can actually lead to severe complications such as stroke, coma, or even death. So when patients ask me about inversion therapy, I always warn them to proceed with caution. Often people think it's the same as decompression, and it is, in that the bones are being pulled apart, creating more space for the discs and nerves. But with decompression therapy, your spine's being systematically and continuously pulled gently apart by a computerized system, which has been shown to be much more effective, way more comfortable, and a lot safer than inversion therapy. So there really is a big difference between spinal decompression therapy and inversion therapy. Now that you have a deeper understanding of non-surgical spinal decompression therapy and what it can do for you, I'd love to hear from you. Have you had treatment for your L4-L5 disc bulge or herniation? What have you done? What has worked for you and what has not worked? Please leave your comments below. And be sure to like and share this video if you found it valuable. Also, go ahead and subscribe right now if you don't want to miss future episodes to learn more ways to enjoy living a life free from pain, filled with health and joy. You should watch this video next if you want to get relief while you sleep and learn the 2 best sleep positions for L4-L5 disc bulge or herniation. Go ahead and watch that video next.